Hello, I'm Dr. G, and today we'll be talking about how to do a cockatiel exam. Now, it's very important to examine cockatiels on a regular basis because they hide their sicknesses so well. Now, there's many good reasons to do a cockatiel exam, and one of these reasons is before buying a bird, to make sure that you're actually getting a healthy specimen to start with. Also, to detect health problems if you examine them on a regular basis and weigh them before they actually become apparent, since birds hide their illnesses so well, and at the first sign of sickness to provide a prompt and specific treatment plan with the help of your avian veterinarian. Now, normally I'm going to use three things to do my bird exam. I'm going to use a digital scale precise to about 1 gram and a little basket there and a perch if they want a perch. And I'll want to observe them in their cage before I actually come out and pick them out. Otherwise, they get stressed and the adrenaline kicks in. So I look at the symmetry of the eyes, if their back is hunched, if their tail is bobbing up and down with every breath, that would indicate a respiratory problem, if they're perching symmetrically. And then I'll just let them know that I'm approaching them, not to stress them too much. And I'll put my hand in and see if they want to climb up. Now, sometimes they're not used to this and they won't want to come up on my hand. So I'm not going to insist too much, and I'll see if they're tame or not. And I might try with a perch to get them out of their cage. Sometimes they do a lot better when they're out of their cage. Or I'll let them out on their own, making sure that their windows are closed, the curtains are closed as well, and there's no ceiling fan going on. Now, once they've relaxed a little bit, I'll let them know that I'm coming, and I'll see if they want to come up on my hand. If they still don't want to come up on my hand, then I might just coax them a little bit with my other hand behind them. And often they'll just climb up and I'll hold them to make sure they don't fall down. Now, let's say this didn't work. So this is really not a tame bird who doesn't want to come up on your hand. Then you can always use the towel technique. I like to use a dishcloth. That works well. It's not too heavy a cloth, so I can feel the birds really well. And I'll bring it just behind them and wrap them up gently, not too tight, not to prevent them from breathing. Then I'll check that they're doing well, that there's no bleeding blood feathers, they're breathing well. And what I want to do is I want to weigh them first. So I'm going to remove the cloth from the bird, and I'm just going to deduce the weight of my cloth here in my little basket or my bowl that I've pre-prepared. So I'll put all this at 0 so that once I'm ready to put my cloth around the bird to wrap him up, I'll get the bird's weight. So I'm just going to tuck it underneath one wing, across the chest, underneath the other wing, not too tight there, making a little V shape around the neck. And I'm going to deposit them gently in my container just for a few seconds, and voila, I've got my bird's weight. I'll pick him right back up, and I'm ready to do my general physical exam. This is Mendel. She's very nice. I've got my thumb underneath her chin, my middle finger behind the neck, and my index on top of the head for more control, or I can put my fingers on either side of the neck, and often they're more quiet if they're cradled in the back of my hand like you see here. So I'm going to take my blunt tip tweezers here, and I'm going to pull the feathers just on top of the head to see if they've got any lesions or parasites. Check the ears right here below the eye, behind these colorful patches. Make sure everything's fine there as well. And then I'm going to look above the nostrils. Often if they have a respiratory problem, the feathers will be all matted above the nostrils. Now, if I'm not sure if the nostrils are blocked or not, I can always do the water droplet test. If I put a little water droplet on top and it bubbles or goes in, then I know the nostril is fine. But if the bubble of water just sits there, I know the nostril is blocked. So that's the other ear. And then I'm going to go look inside the mouth. They have this slit on the hard palate, the choana. So I'm going to look if there's choanal papillae, if they're okay, to see if they have vitamin deficiencies or lesions in the mouth, white plaques or yellow plaques, that would be abnormal. Then I'll unwrap them a little bit to check the crop area to see if there's seeds in there or fluids. And then I'm going to check their hydration, see if the skin moves freely over their keel bone. That's quite pointy. So then I'm going to see if they have a good weight by passing my finger across the chest underneath one wing to the other wing to see if it makes a nice U shape. If it makes a V shape, they're too thin. If it makes a W shape, they're too fat. Then I'll check the feet for pressure sores. Now this bird's got a little deformed foot because her last toe there is tipped forward. It was probably dislocated quite a while ago. So it's ankylosed there, it won't move anymore. But there's no evident pressure sores, so she's doing quite well. I'll check the abdomen for eggs or tumors, and that their cloaca is nice and clean, their vent area, and also that the uropteral gland is symmetrical, just behind the tail there. Then I'm going to check underneath the wings. There's a blood vessel that goes across the wing there that I can see if their blood pressure is quite good or not, just by pressing on it and releasing it. I'll check underneath the wing, the other one. There we go. And then I'll flip her over to check for the back. I can see the uropteral gland on this side too, their preening gland. I can see if they have any wounds on their back. So Mendel is doing quite good here. So I'll put her back on my finger. I'll just stabilize her a little bit until she gets her balance. There we go. Do the shake. Get rid of all that stress. Place your feathers. And we say bye-bye to Mendel. It's been really nice. Bye-bye.